per adult, $375 per child in 2016. Now, if I remember correctly, based upon that JCT letter, of course, with the clarification of healthcare bill, I'll post in the video of what I'm referring to, and my last video, and that last video about healthcare again with, with the House of Representatives, as they already passed the bill on their end, that there's supposed to be some kind of a $15,000 fee or some sort of penalty fee. But this one, through this document again, it's like misrepresented what I actually received the information of. So there's a little confusion about how much you're going to be penalized for and for what reason exactly. Now, on page 24, the national average premium would be $5,200 for a single coverage and about $14,100 for a family by 2016. Non-groups will be about $5,800 single and $15,200 family. Again, that's another distribution of wealth and perhaps more taxation upon us as well. Page 26. Under the black bold again, effects on excise tax on high premium insurance plans, the threshold will be at $8,500 single, $23,000 for family policies in 2013. People who remain in high premium plans would pay higher premiums under the excise tax. Obviously, you're aware the excise tax regarding more about the trades and etc. Basically, just from my own personal experience, guys, within about a year to 5 years, I will be basically within the 100 to 200% of income relative to FPL, which is the federal poverty level. I may get paid between 7 to 12% income tax on Medicare, Social Security, and other local and state taxes. Now, here's what I don't understand about the government, what they're proposing. Why is it that they're taxing us like crazy? They know that we don't have any money in this economy. They know that we're contracting more than we're expanding, and they're pumping in excessive amounts of federal notes. That's what I have in my wallet here. And after a while, it's going to screw us up, and not only in the short term, but the long term as well. In comparison to what the government is trying to do, it's more control than it is equality. Think about it, guys. When it comes down to school, have you noticed for the last 20 years, especially with my recent experience, that every year 5% of the tuition has gone up? So I went to a college in upstate. My major was culinary arts. It was originally $5,000 a year, and now it's up to about $7,000 a year within not even 4 years. So that's basically literally like a 5% every year within the last 4 years. So what makes you think that with the government being involved with the healthcare will be any different? It's going to basically be more increased fees, increased fines, more control, and that's about it. It's telling you go with this plan. But here's a strange thing about I don't understand about government. Why is it that our politicians are receiving a nice, high, decorative type of service when it comes to healthcare? The top-notch doctors, specialty doctors, the surgeons, you name it, they got it all. Even down to sick time. They'll have like maybe hundreds of hours of sick time with ease in a matter of weeks. Kind of a weird expectation from Congress people. So here's my proposition, government of the United States. Yes, this is a message to you, government, that if you, I don't know, have any sense in mind, please do not forward this to the president. Please do not pass it in completion and succession to the president. And if Obama is about to sign it, if you are going to sign it, you'll deal with the consequences in the not too distant future. And I don't know what has been going on with these politicians, with all these bailouts and loans, and it's so quote-unquote loans that they're providing towards these bigger and supposed too big to fail companies. It's actually making things out of whack as well. So we're going to see a chain reaction within the next few years if the government doesn't stop this. So government, just step out, just stay out. My proposition to you, government, is that you stay out of healthcare, you stay out of these subsidiaries and whatever you like to call them. You see, you can get involved, have some regulation on the occasions when it's necessary, but not 100% in there with the market. Let the market go, because the doctors, the nurses, the specialists, they know what they're doing for their patients. They know how to do their job. And you, by far, government, you haven't done that for us people. You just basically got interfered between the doctor and the patient. I see it with my doctors right now who don't, I'm not sure if they don't care, but based upon their actions, they're not interested in really engaging with their patients. That's my experience, guys, because I wasn't like that several years when I was a kid. And it's getting to be weary. And it's like, and I'm hearing that from one of the radio shows that 75% of doctors will quit once this healthcare thing will pass. So what good would that do? And keep in mind, when people think about doing that and say they will do it, they will do it. Thought equals words equals action. What are you gonna do, government? Obama, Biden, Harry Reid, Mitch McConnell, Michelle Bachmann, Sean Hannity, who, forget about those Fox 5 guys, but you get the idea, guys. So, my personal proposition is that if you do pass this bill, in retrospect to my proposition to the government, I will not consent. Because I know, and I am not only alligator, but it's a certainty that you have to provide me papers for me to submit myself to it. I have to submit, beg, and apply for it. And if I don't see any paperwork regarding about that for me to fill out, which I will not, and you still take out money from my check and regarding no matter what it is, I am going to do my best through my employer and through the courts to oppose this healthcare thing to me. Now, I understand I'm not picture perfect health, and we all human beings, we all die in any given moment of our lives. But at the same time, you cannot force people against their free will to get coverage. Let people, the doctors who care for their fellow human beings, do that. Don't just give them bureaucratic, political, detrimental disasters. So, politicians, government officials, please keep this in mind. And please keep in mind, ladies and gentlemen, that you do have this right not to consent. You do have this right to look into it. And if they refuse to even talk to you about these issues, if they refuse to even explain further, to clarify what they're trying to do for us exactly, don't consent. Don't submit. It helps. Happy holidays, guys. Merry Christmas. Happy Kwanzaa. And Happy Hanukkah. And all the holidays in between. And Happy New Year. Have a nice day. This is Dr. Ghetto signing out.